Is there anything about the pattern of cough, anything about the cough that in your experience can differentiate a cough that's due to lung cancer from all the other ones that the GPs are now trying to exclude?
The cough itself, no. I mean, we see lots of patients, as Simon and Louise say, who have cough like this that's very non-specific and mostly is benign. So that, no, just the cough itself, I don't think there's anything that you can use that would make you worry. Maybe beyond a progressive cough, if it's progressive over time and resistant to all sorts of different therapies that the general practitioner would try, that might be something that would worry a bit more than otherwise, but that'd be about it in my mind. Yeah.
Okay. Brian and Shalini and Michael, in your experiences at this very early stage, is there something about the quality of a cough that you guys pick up?
The ones I see at this stage at the golf club. And if they tell me they got a cough, I tell them to get a chest X-ray. It's such a painless, cheap, available in every milk bar. But I don't work in general practice. But I obviously would get an X-ray a lot earlier than my general practitioner colleagues. I think everyone thinks too much.
Although, in fact, in this particular case, there has been an X-ray, which is normal. But in answer to your question, Stuart, there's nothing special about the cough except that it's not going away. I mean, that's, if you like, the alarm bell. Because I guess it would be nice to have an explanation. The lack of an explanation, that explanation might turn out to be something nasty, might turn out to be something non-nasty, but it would be good to have a clear diagnosis of why there is a cough there.
Okay, Shalini, any other comment to add?
No, not really. I don't think you can differentiate on the nature of the cough itself.
Now, bear in mind, of course, Brian said that people think too much, which is the nature of surgeons, to actually go straight in and do something. I mean, one of the important things to point out here is that surgeons, by their very nature, approach problem solving by doing things, and that's important. You want people to do things. And one of the things I hope we'll realise as we talk through today is that you want all different perspectives, because people see the action from different perspectives and come to different conclusions, and sometimes you need to collect all the data by people who approach it with different strategies and different approaches in order to come to a full appreciation of what's happening. There's a question here.
Just at what point would you ask if the patient has got any had any previous industrial exposure to asbestos? Would that be a question that would come up during your...
Yes. Can I answer that one? I actually spend most of my professional career as a rural doctor, and there's a whole range of environmental hazards that you come across, particularly some of the pneumoconioses, which are the industrial type diseases. I think when you're starting to go down the track of asthma quite early, probably in the first or second consultation, you certainly would be asking about triggers, and that would include a past history of cigarette smoking, a past history of any industrial exposure that you could raise. In my community, there is a high incidence of respiratory conditions associated with grain, and moulds associated with grain. So that question tends to come in quite early in the piece.
I have a special interest in musculoskeletal medicine, and I see a lot of back pain and often associated with cough, and probably the commonest cause would be a costovertebral joint dysfunction associated with chronic cough. So I'd certainly look at the patient's back and see if I could find something that actually fitted the symptom. But I agree that the pain was getting both worse, but also going through to the back would be a worry. With the chest X-ray, I mean, Louise and I in our practice would have both been engaged to teach general practice registrars. That's why we're not there full time. And so we're very across evidence-based medicine.